And I'll share my slides. All right, let's get started. Okay, so my name is Rebecca Penn, and I live in Gapuich, which is in Mi'kma'ki, the traditional unceded territory of the Mi'kmaq people, which is colonially known as Nova Scotia. And I'm the project manager for the National Safer Supply Community of Practice, which is based out of the London Intercommunity Health Centre. Um, I'm really excited to have you all join us today. We have Sue Jane Sang from Health Canada. Sue Jane, I'll let you introduce yourself in a moment. Yeah, you'll be chatting with us about CDSA compliance. So just some housekeeping bits. We are recording this and I will be sharing it on our website. We'll also be including it in our pharmacy toolkit that we're developing. I do ask, we are using a meeting format instead of a webinar format. And that means that people can talk and see each other. You can have your video on or off, but I do ask that you keep your microphone on mute during the presentation. And if you have a question or want to make a comment, if you could raise your hand, we'll get to you. So just for those of you who are not members of the National Safer Supply Community of Practice, just a quick word about who we are and what we do. So we are, as I say, based out of London Intercommunity Health Centre, and we began in 2021 with our primary goal was to support the scale up of safer supply programs that were funded by Health Canada's SUAP program. Our goal has evolved now that we have been developing an evidence base for prescribed alternatives, also known as safer supply. Our goal is now very focused. We've expanded to look at the wider continuum of care for people who use drugs, making sure that people, with our goal being an accessible evidence-based continuum of substance use healthcare that includes prescribed alternatives, as well as more traditional approaches such as opioid agonist therapy and other approaches. We currently have a membership of over 1,800, of about almost 1,800 people. Our membership comes from across Canada and as well as outside of Canada, and is very interdisciplinary, including healthcare providers, social care providers, researchers, policy analysts, and people who use drugs. And our primary goals are around knowledge mobilization and capacity building. We do a lot of webinars. We have a pretty extensive website that has a lot of different resources, including guidance, documents, and clinical protocols, as well as an evidence brief, a resource library, and an archive of previous webinars. So I encourage you to have a look at that. I'll put the website in the chat shortly. We do offer a certificate of attendance throughout the presentation. I'll pop a link to the certificate of attendance if you would like that. It can be useful for different purposes. So just if you want a certificate, then you just click on the link and it will send you to a form which you fill out, and then you'll get an attendance or a certificate of attendance in your email box. And if you're not already a member of the community or practice, I do encourage you to join us. We have a number of working groups happening right now, looking at clinical guidance to support providers, and that includes pharmacists. Yeah, we've got a lot of different resources and webinars coming up. So I encourage you to have a look at our website for more information about registering, as well as upcoming events. And with that, let's turn it over to the main event. Sue Jane, I'm going to stop sharing here and let you take it away from here. Thank you.
Great, thanks, Rebecca. Okay, give me a second and let me figure out how to share my screen again. Okay. All right, and can everyone see the full presentation?
See, there you go. You got it.
Perfect. All right, great. Okay, so let's get started. All right, so hello to everyone and welcome. My name is Sue Jane Sang. I'm the team leader for pharmacy inspections in Central Region, and I'm going to be talking to you today about pharmacist obligations with respect to Controlled Drugs and Substances Act, with a particular focus on inventory control, loss or theft reporting, and security. So the reason we're focusing on these particular areas today is because I know the audience today mainly deals in high volumes of controlled substances, which can make it harder to keep track of them and keep them properly secured. Okay, so we'll move on. Before we begin, this is our standard disclaimer that this presentation is not part of the Controlled Drugs and Substances Act and its associated regulations. The information that's contained here is accurate at the time of the presentation and is subject to change in the future. So here's a quick outline of the topics that we'll be covering today. We will go straight into associated regulations and obligations. Most of our time will probably be spent on inventory control, and then we'll go on to loss or theft reporting, security, and record keeping. And then at the end of the presentation, we will provide you with some additional resources like links that might be useful to you. Okay, so straight into the regulations. As you probably know, Health Canada is a federal department responsible for helping the people of Canada maintain and improve their health. So when it comes to the controlled substances, Health Canada helps to protect Canadians by authorizing legitimate use of controlled substances and precursor chemicals using a risk-based assessment and evaluation process, and by performing compliance and monitoring activities such as inspections. Our main goal is to minimize the risk of diversion. So these are the two main acts that we are concerned with today. The main one we're looking at is a Controlled Drugs and Substances Act, which I will likely abbreviate to the CDSA for the rest of the presentation. It provides a framework for the control of substances that can alter mental processes and cause harm to health and society when diverted or misused. The acts and regulations are Canadian laws, which apply to pharmacists as being the regulated parties that are held accountable for the security of their controlled substances. So, as a pharmacist, this means that you are legally required to cooperate with us. You must provide the requested records, including reports, prescription files, purchase records, or any such that we will request during an inspection. It's important to remind you that it is illegal to obstruct the inspector in the performance of his or her duties, or to knowingly make a false or misleading statement to the inspector, whether it is orally or in writing. Failure to cooperate can be considered obstruction, and it could be subject to legal action. I'm mentioning this just for your information. Normally, we will always seek cooperation so that we can help you to improve your controls and security measures to ensure that you're in compliance with the Act and regulations. Taking legal action is always a last resort for us. Okay, so now that we're done with the regulations, we'll go into inventory. So perpetual inventories. The ideal, especially in a high volume pharmacy, is to maintain a perpetual inventory of all controlled substances in your chosen pharmacy system. So while pharmacies may have an itemized inventory that is updated on a periodic basis, a true perpetual inventory is a system that continuously records inventory changes on a transaction to transaction basis and updates the records in real time. So a part of maintaining this perpetual inventory is verifying it regularly. This is often done by counting your on-hand stock and comparing it to what your perpetual inventory says you should have. So in this comparison, your perpetual inventory provides a theoretical number of each substance, and the physical count provides your actual numbers. By comparing these numbers, it can give you an idea of whether you are in control of your stock or if there are possible discrepancies that will need to be investigated. Discovering and investigating the root cause of these discrepancies can help you to detect or prevent diversion, but it also depends on how well the perpetual inventory is maintained. The accuracy of your perpetual inventory is only as good as you make it. Pharmacy software can provide calculated and forecasted inventory values, but even these can be subjected to error. For example, miscommunication between local distributor and the pharmacy's purchasing and receiving department, miscommunication between various systems used in the pharmacy, like one separate for sales and another for inventory keeping, or even the mishandling of prescriptions or cancellation log. So this is why we also recommend doing an accountability reconciliation periodically. We'll look more into physical counts and reconciliations in the next couple slides. So we'll go over physical counts first. Doing a count and comparing it to your theoretical inventory can help to catch some pilferage, but not all of it. As previously mentioned, regular physical counts can help you to keep control of your inventory and can lead to the early detection of any potential diversions. However, you cannot rely solely on these counts. These numbers can be manipulated in your system if someone knows where to do it. So this can happen in manual adjustments. If the person doing the pilferage has full access to your system, they'll be able to manually adjust it to cover up the amount that they're taking. And we use this as an example because we have seen this exact scenario before. So an easy example of this is if I were to take a bottle of, say, 100 tablets of oxycodone, and then I went into the system and manually adjusted your inventory and deducted 100 there. So when you do your actual count, the number that you see on the system should match up with your count because it's been adjusted. But in reality, you're still missing those 100 tablets. So another way to manipulate the inventory is also to create fake patient records or use existing patients to create fake dispensing records. This is something that is more difficult to catch, and it requires looking through prescription verification. So in addition to completing regulatory inventory counts, you should be doing what we call a complete reconciliation. Okay, so what exactly is a reconciliation? Some of you may be familiar with it. For those of you who are not, hopefully this will help clear up some things. It's basically an exercise that's similar to balancing your bank account. You take into account how much inventory you have on a certain date. This would be a verified count, then adding all of your purchases and subtracting the amounts that you dispensed or returned. This gives you a calculated number, which should match the number of your actual count on that day. All of the discrepancies identified will need to be investigated, and you must keep a record of these investigations for at least 2 years, because if you get it audited or an inspection happens, we'll definitely be looking to see those records. Also, do not adjust your inventory without your investigations or correcting the issue first, and ensure that you always enter a comment or note when you're making your manual adjustments. This is something important because a lot of people think that they'll remember it, but when you go back to look at your adjustment weeks or months from now, you're not going to remember why you made the adjustment, and that's really important for your investigations. All right, so let's do a simple reconciliation exercise. So we will use the following as a starting inventory. This should be, again, verified. The purchase quantity, which is the total number of tablets purchased within a set period of time and verified using your purchase records, and sales numbers, the total number of sales in the same period of time verified from sales or prescription reports. So the period of time we're looking at in the example would be from October 3rd, 2023 to the present date. On the October 3rd date, you counted 250 tablets of dilaudid 8 milligrams, say. You had a purchase of 800 tablets within that time frame. So you add those purchases, which gives you a total of 1,050. And then you had sales amounting to 750 tablets. So minus the sales, which gives you a calculated balance of 300 tablets. This is your calculated theoretical number that you will use to compare against your current physical count. Okay, so you physically counted 200 tablets and you have your calculated balance of 300 tablets. That leaves you with a net negative of 100 tablets. So this is considered a loss and will need to be investigated. Depending on the outcome of your investigation, that will determine your next steps. So just to note that when you do your reconciliation, if you have a discrepancy, whether it is positive or negative, you should be conducting an investigation. Today, we're going to be focusing on losses, as that is what is the main concern for Health Canada and the number that you need to be reporting. So how exactly are you conducting your internal investigations? What we have here is a list of possible actions that you can take in your investigations into the discrepancies to try and determine what happened to your lost quantity. So please be aware that this is not an exhaustive list. There are numerous other possibilities, but exploring these situations is a good starting point. Some other examples that are not listed here are aforementioned manual adjustments, making sure that they were justified, and also looking at your dispensing records, like ensuring your quantities are all associated with prescriptions. While you're doing your investigation, it's important to document everything and ensure that it is kept in an auditable format in case of an inspection or an audit. And remember, the more frequently you do your counts and or your reconciliations, the fewer records you'll need to look through because you'll be using shorter timeframes and likely you'll be coming across less discrepancies. So the more frequently you do these things, it can make it easier and less time consuming. So what happens after you've finished your investigation? If you found a definitive explanation for the discrepancy, make sure you have your investigation and evidence documented, adjust your system inventory as needed, including explanations in your manual adjustments field, and file it away in an appropriate and safe location. If you were unable to clearly identify the reason for the discrepancy, this is now considered an unexplained loss. So please be aware that sometimes we'll look at the quantity and just assume that we know what happened, like it was a miscount or a spill. But this doesn't equal a definitive explanation. If you only have an assumption of what happened at the end of your investigation, this is considered an unexplained loss. So ensure all your investigation steps are documented and filed away, make the necessary adjustments in your inventory, and ensure you report your loss. We get a lot of questions about reportable losses. Some things are pretty straightforward, like a robbery, a dispensed forgery, or pilferage. So these will be reported as a theft. But if the loss is discovered during a regular inventory count, such as we've been describing in the past couple of slides, and there's no documented evidence, then you have to report the loss to Health Canada. You'll have 10 calendar days to report from the date of the initial discovery. So you need to act fairly quickly. And remember, this applies even if it's only a one tablet shortage. Health Canada operates on a zero tolerance rule. Another thing that might make your life a little bit easier when it comes to accounting for your count discrepancies is keeping a simple informal log that's just for pharmacy purposes. This is a log of any spills, such as methadone spills, or tablet or capsule breakages. Okay, so on our website, we have guidance on reporting loss or theft of controlled substances and precursors. The guidance has a handy chart at the end that gives you some examples of the type of loss and when you would need to report it. So this is not an exhaustive list, but it gives you a pretty good idea of the explanations where you would not need to report. It's pretty lengthy in terms of the losses. So it's on this page. Next one, you notice that actually quite a lot of the losses will not need to be reported. And here we have theft. Usually, if it falls in the category of theft, you'll need to send in a loss or theft report. So a link to the guidance will be provided at the end of the presentation. Okay, so how do you report your unexplained loss? Health Canada's e-services portal is the fastest and most accurate way to submit your loss or theft. You may also want to download a fillable PDF version of the loss or theft report form and send it via email. I know for some older pharmacies, they may have retained a fax number from many years ago. Please do not use this number. The Office of Controlled Substances, also known as OCS, no longer maintains a fax line. So if you try to send it that route, it will not go through. So while you can email or submit by portal, I would recommend going through the portal, as you'll be able to view all of your reports that you've submitted in one place. You'll be able to amend them there, and your reports can automatically be uploaded to their system. This reduces lag time in OCS receiving your report. It reduces human error, as email submitted reports have to be manually added into their system. And it also reduces errors in entry of substances, because when you go into the portal, it gives you access to a searchable and comprehensive controlled substance and precursor database. Another thing to note is that while all of your submitted reports are saved through the portal, this is effectively a third-party repository for your records. It is important that you also save a PDF copy Keep it or print it for your own records to be kept on the premises of the pharmacy for at least 2 years. We'll have links at the end of the presentation for the portal website, as well as an FAQ and instructions on how to set up an account. Please also note that these logins are for an individual and they're not to be shared. So it's connected to the pharmacist, not the pharmacy. So pharmacy assistants, students, and registered techs can also create an account on the portal, but they are not able to submit the loss and theft report. They can create the report, but they have to send a draft of it to the pharmacist for final approval and submission. Okay, here's an example of our current loss or theft report form in PDF format. Whether you're using the portal or email, providing as much information and context as possible really helps the triaging and screening process in OCS. The reports are looked at, and if there is insufficient information, it can lead to a compliance verification review, which can in turn lead to an inspection if we have concerns regarding things like circumstance of the loss or theft or the corrective actions that were taken. Okay, and what I say next is probably very familiar to you by now. Again, you have 10 calendar days to submit a loss or theft report starting from the day of discovery of the loss. But one of the things that I want to make sure that you're aware of is that you can always submit the loss or theft report before you conclude your internal investigations. If you think you will go past the 10 calendar days, if at the conclusion of your investigations, it changes the loss or the quantity or anything else, you can please ensure that you submit an amendment to the report. You can do this easily by going through the portal and make sure that you provide the original report number so that the amendment and the original report can be linked. Okay, let's go on to security. Federally, we do not have specific requirements such as a prescribed list of mandatory security elements. What we do have in the federal regulation is a more broad spectrum requirement due to differing provincial requirements in how controlled substances are shelved and stored at the pharmacy level. Health Canada does not require that these products be stored in any specific way, such as in a safe versus dispersed on shelves, or keeping similar types of drugs together versus separating them out. It is the pharmacist's responsibility to ensure that the methods they use to manage their controlled substances stock allows for a high level of security. This is an important part because I should mention that security is where the most observations occur aside from inventory control. All right, having said all of that, these are some of the physical security measures that are recommended to help ensure compliance with federal regulations. So alarm and surveillance system. If the pharmacy is located in a larger retail space, the dispensary area should be on a separate alarm zone. For physical barriers and deterrence, we're talking about things like window protection, bars, glass breaks, having locked doors, contact sensors on the doors, locked cabinets, video surveillance, and things like narcotic safes. Those are all recommended. Restricting your access to the dispensary. So a pharmacist must always maintain supervision of activities involving controlled substances. You should only pharmacy personnel should have access to the dispensary. So if the pharmacy is connected to a retail area, retail clerks or even retail managers should not have free access to the dispensary area. Okay, no sharing of narcotic ordering codes, pins, and or keys. This should never be shared amongst pharmacy personnel. Like your portal account, the narcotic code is connected specifically to the pharmacist. It is not to be shared with all pharmacy staff. We see this all the time. This is probably our most common observation in terms of security. Okay, a couple more security considerations. We know most, but not all provinces have mandated time delay safes. So in those where it isn't mandated, it can be a consideration depending on the pharmacy. The next is reasonable inventory level. So an important point, which may be more difficult for this audience because of the high volume, is keeping a reasonable inventory. Try not to order large stocks of substances to keep in your inventory. By keeping a lower inventory, you can help prevent excessive loss in the event of an armed robbery or break-in entry, and you can potentially deter internal theft or pilferage because when you have a smaller quantity, it's a lot easier and faster to notice when something is missing. Also, unnecessary large stocks can prove challenging for some pharmacies to store in a secure manner if you don't have, like, say, if you don't have a large enough safe. Also, remember, pharmacists have to conduct regular inventory counts, and high volumes can make it much more difficult to count accurately and can likely result in more discrepancies. Okay, so let's wrap up with record requirements, which we've kind of mentioned throughout the presentation. So as we've mentioned, records must be maintained for at least 2 years or longer, depending on provincial regulations. And these records should be maintained in an auditable manner. Now, most of you are probably more advanced than us and you're trying to make everything paperless, which is great. You just need to ensure that your system meets the requirements of the relevant regulations, such as the ability to separate out the controlled substances prescription files from regular prescription files, and also that the files can be saved in a secure and high resolution format. This is especially referring to prescriptions that are scanned in. So please make sure you have an appropriate backup system in place to avoid loss of this information. Also, please make sure your electronic records are saved on the premises of the pharmacy or can be accessed and provided within 24 to 48 hours if requested. Do not depend solely on a third-party platform that you do not have control over. Okay, here's a quick look at the types of records that we touched on today. One of the other things I wanted to mention is exempted codeine products. Their inventory must be tracked and reconcilable through purchase records and sales reports. Another thing to mention is script review. If an inspector comes for an inspection, they may conduct a spot check of prescription files or look on more specific controlled substances molecule dispensing records. So complete records related to prescription transfers as permitted under the current exemptions must be maintained as well. Okay, and that concludes the main body of our presentation, but here we have some resources. The QR code leads directly to the topics that are listed on the slide. That leads to our Health Canada Pharmacy splash page. So if you have a phone handy, you can access this easily, but we'll also include a link to it in the chat box. Here are some more useful links. These aren't included in our splash page, but I believe we'll be disseminating the slide presentation later on, and these links should be clickable, so you'll have access to them as well. And finally, here's our contact information for each of our regional offices if you wish to reach out to us. As we go into our Q&A session shortly, if you have any other questions or concerns after the presentation has concluded, please feel free to reach out to us. We will do our best to answer any questions, and if we're not able to, we will pass them on to someone who can. So thank you for your time and attention. And before we open the floor, I just ask that you also complete a short survey for us. The survey helps to inform the development of other future presentations, and feedback would help us to improve our current presentations. Just a note that when you go into the survey, after selecting the date, it will ask you to select which presentation you attended. And for this one today, please select CP Series, Inventory Control, and Loss or Theft Reporting. We'll include a link to the survey in the chat box, as well as the name of the presentation title to select. And that's it. Thank you.
Thanks so much, Sue Jane. Lots of great information and resources there for folks. You want to open it up for questions from
Sure.
attendees? Thanks, Sheila. Anyone have any questions? It's a quiet group. Sue Jane, what kind of problems are the most common that you see people struggle with?
Okay, so where I do inspections, my region is Central Region. It's in Ontario. I can talk about maybe recent experience, especially with the incoming, well, it's already established now that all pharmacies need to have the time delay saves. One of the things that we've been checking on, and this is also to kind of help with OCP, is that the time delay safes are being used in the manner that they're supposed to be, making sure things. So this is all surrounding security, right? Like if you have a time delay safe, it has to be closed. It does no good to have the time delay if the safe is not locked. Yeah, and also there's many times when we've gone to the pharmacy where they've got a safe, it's got the space, but they don't have the substances in there.
In the safe.
Yeah. So I mean, you can only do so much, right? You can have the equipment, but if you don't utilize it properly, then it's kind of a moot point. One of the other things we do, and I know this is really, really hard for pharmacies, especially if you're high volume, you're probably very, very busy. There's a lot of prescription to fill, but documentation, things like keeping track of your counts, your records. It's rare, but like we've gone to pharmacies too, where even if they have the records, they can't find them because papers are kind of just scattered all over the place. So it sounds a bit painful to set it up, but I would say that if you start in the beginning and have it set up, you save yourself a lot of pain going forward, right? Because the things with documentation, like paper only accumulates, the documentation only accumulates, right? And the more you have, and then say the more your inventory grows, the more it seems unmanageable.
Thanks, Sujane. I'm wondering if there's anybody who's watching the webinar right now who might have examples of tips and tricks that you've used to help you stay on top of all of the different steps and processes. I'm imagining a whole bunch of people who are listening in while also filling scripts and doing things.
I mean, if you guys have questions on things other than what we presented on as well, feel free to ask them. Like we'll answer them as best as we can. I can tell you that we've developed a couple of different presentations. So the one that I spoke to today was inventory control, loss or theft reporting, things that I thought would be especially important here. But we also have presentations on destruction, and I believe forgeries was the other one.
Oh, wow. Go ahead, Greg. Thank you.
Hi, thanks. I put a comment in the chat, but I have a question just surrounding patient returns and the requirement for inventory control for any CDSA drugs that are returned for destruction by patients after they've already been dispensed, and kind of what our responsibilities are. I think I have a good understanding, but just feel like this is a good opportunity to ask.
Sure. Sorry. What's the question?
So just like the question is just surrounding like what are our requirements as pharmacists when patients return CDSA drugs after they've already left the pharmacy and they have no longer any use for, in terms of inventory management and destruction.
Okay, so we don't require you to have any kind of inventory, like categorized inventory for patient returns. Like we don't know the state that they're being returned in, right? Like you could get a baggie of stuff, you could get a bottle full of like a mixed pills and things, right? So we don't expect you to keep an inventory of it. What we're more concerned with is keeping that stock secure while you have it, and making sure that you do the proper documentation and procedures when you destroy them or before it's being sent out to like a licensed dealer for destruction. So it would follow the same protocols as your like expired stock, in terms of if you destroy locally, make sure you have the address of the site. In the case of patient returns, it would be like the number of bins that were being destroyed or containers. I have a witness signature as well and the date. I think that's all of it.
Awesome. So if a patient brings back expired medication and everything's just mixed together in a bag, we have no responsibility to sort through that and try to identify anything that's narcotic or controlled drug. Okay.
No, I mean, if they're able to tell you, even if they say there's some narcotics in there, just consider the entire thing it has narcotics, so treat it as such. Yeah.
Thank you.
Any other questions? Well, Sue Jane, I think
Quiet.
you did, yeah, you quiet, but also you did a very clear presentation. So there we go. Yeah.
Great. Well, I hope it was informative for everyone.
Yeah. And maybe I can follow up with you and about setting up for one of the other presentations for folks. Might
Sure,
enjoy
that'd be
that.
great. If there's
Oh,
interest.
hold on.
Yep.
Alex has a question. Hi, Alex. Nice to see
Sorry.
your face.
Yes, nice to see yours. It's not really related to the presentation, but since you're talking about other presentations, like, do
Yeah.
you do presentations for pharmacy schools? Do you do presentations for, who do you do presentations for,
Okay.
I guess?
So our audience is kind of ever expanding. We started off with mainly pharmacists and going to the pharmacy associations and also some like larger pharmacy corporations. But we are expanding. Last year, we did do presentations. Our Eastern counterparts did presentations in universities. So we are developing a presentation that's geared towards pharmacy students. That's a
Amazing.
bit, yeah, so that's a bit more, we're trying to make that a bit more interactive with like case scenarios and things because we're not always certain of the amount of like on-hand experience that the pharmacy students would have. I would say like we're also expanding towards technicians because pharmacy technicians will likely be having more responsibilities with the change of the with the controlled substances regulations coming in next couple of years. And we are also open to talking to prescribers as well.
Great. Thank you so much.
No
It
problem.
was such a great presentation.
Thanks.
Yeah, you present very well, Sue Jane, very clear and lots of good information.
So much practice.
Yeah, yeah, that's great. And it's a nice manageable little chunk for people to listen into as well.
Yeah. Sorry, I was just going to say, when you do the survey, if you guys are able to provide feedback, one of the things that happened with these presentations too is that we did break them up and break them down and put more detail into smaller subjects. Because I think we realized our original presentation was really long and it also didn't leave enough time for like questions and answering. And like you're pharmacists, right? Like you're busy all the time. And a lot of you were calling in from the pharmacy. So having like a half hour, 20-minute presentation and then leaving another like 20 minutes or so for questions was a lot more feasible than doing like an hour, 45-minute long presentation. So like whatever feedback we get from you guys, we definitely take that into account and try to adjust our presentations accordingly.
That's great. Yeah, that makes good sense. I'll also just do a plug about the clinician meeting for National Safer Supply Community of Practice members. So we have a monthly meeting. It's the first Wednesday of every month at 3 p.m. Eastern and held on Zoom. And it's for physicians and nurse practitioners and pharmacists who are prescribing and dispensing prescribed alternatives and providing care more broadly for people who use substances. So yeah, that if you're not already a member, that's one reason to join. All right then. Sue Jane, is there anything else that we should bring up right now?
No, I think that's it. Rebecca, I can send you a PDF copy of the presentation if you wish to disseminate that further.
I will. That would be great. I'll put this recording and the slides and the links to the resources that you shared all up on our website.
Great, thank you so
And
much.
then I'll distribute that across the community of practice. And yeah,
Okay.
excellent. Okay, folks, unless there's any other questions, we can say goodbye for today. Short and sweet.
Okay.
Sue
Thank you.
Jane, thanks so much for your partnership and making sure we get good information out to people. And yeah, appreciate your time and your work. And thanks to everybody for joining us.
Thank you very much.
Bye.